So welcome back to KLY, where we look at everything that has to do with staying young. In this episode, we're going to focus on how it is that we start to age, because if we want to keep looking young, we have to know how is it that we're aging and what can we do to fix it. So let's zoom in on how it is that we age, what's the process, what's happening, and then you'll understand better why it is that we do the treatments that we do and our approach to this issue. So with aging, the main issue and the biggest factor has to do with, at first, our outer layer of our skin, which we call the epidermis. The outer layer of our skin is incredibly thin. It is actually, this is just a regular sheet of paper, and it's actually the thickness of the edge of this sheet of paper. So our epidermis is insanely thin. And yet this layer of skin, the outer layer, that is responsible for shielding us from the ultraviolet rays of the sun, which 90% of the aging that we see typically is related to ultraviolet exposure, in other words, the sun. So it's very important to look at the epidermis and what is happening in terms of how we age. So the skin cells in that very small, very narrow layer of skin are responsible for providing our normal skin color and our normal skin texture. So when these skin cells have been absorbing and getting exposed to extreme amounts of ultraviolet over a long period of time, these cells become damaged. They no longer function in the way they're supposed to. So instead of them staying connected and then progressing through the epidermis up to the top of the epidermis where we produce the dead layer, these skin cells start to disconnect and you get abnormal structural changes to the epidermal layer. That layer is responsible for sealing in our moisture. So if that layer becomes imperfect or starts to become damaged, what we're going to see is we're going to lose moisture through that layer. And if we lose moisture through that layer, our skin is going to feel dry, which is, of course, one of the first things we start to see with aging skin. Another thing that we commonly see with aging skin is it starts to feel rough. It no longer has that smooth texture. A big reason for that is that these skin cells that, again, connect to each other and perform and produce a very tight seal, they start to break their seals, and they also create an abnormal or irregular accumulation of cells, so that instead of the cells forming a nice even layer throughout, they start to create these little hills and valleys. And to our finger and as we feel our skin, you're going to find that that creates also a rough texture. So sun exposure over time creates irregularity of the top layer of our epidermis, and it also creates dryness to our epidermis, or we start to no longer have a good tight seal or barrier to maintain or create our moisture level that we need to have in our skin. So the other thing that damaged epidermal skin cells do is they start to produce abnormal amounts of pigment, or what we call melanosomes. So now we have these cells whose job is specifically to distribute pigment throughout our skin. And now these cells are doing it in an irregular or abnormal fashion. So instead of us having this typical youthful uniform color of our skin cells, of our skin that we typically see where everything is one shade, we start to see that the color is now irregular. So this is why you typically see these excessive pigment areas where you have these brown spots and or excessive freckling, or in some cases you can actually see a reduction of uniform pigment deposition. So in that case, what you're going to see is basically white spots on the skin. This is very common in people with olive skin. So all of this together creates a very uneven distribution of color of the skin, which is not what we typically see in youthful skin. The last thing that you also will see with sun exposure on the epidermis or top layer is that even the pore openings start to change and enlarge. And so, for example, in this picture you'll see an example of someone whose pores are starting to enlarge, and this is very commonly seen with sun exposure. Of course, everybody genetically is different in terms of how their pores typically are. So I'm not saying enlarged pore size is only due to sun exposure, but what I am saying is it will definitely get worse over time with sun exposure. In addition, I mentioned to you earlier about the spotty changes and the irregular coloration of the skin with sun damage. And in this other image, you're going to see an example of somebody who's already just in their 20s that is starting to develop abnormal pigmentation of their skin. You're starting to see spotting and freckles. So over time, all of this gets worse. And of course, what you see in total is basically a weathering of the skin. So spotty, dry, irregular. You even start to get growths on the epidermal layer. So that means you start to see little bumps starting to come out, little growths. We call these keratoses. So now you have this in addition to deal with. So this is the normal progression of what we see in aging skin at the outermost layer, which collectively all of this again produces a weathered or older skin. Okay, so we covered the outermost layer, which I mentioned is called the epidermis. And now we're going to get to the next layer, which is affected very much also by sunlight, because sunlight can penetrate beyond the epidermis and get into the dermis. So the dermis is the layer of our skin that contains the collagen and elastic fibers. And as you might imagine, if your collagen and elastic fibers are starting to get damaged, you're going to get some fundamental structural changes to your skin quality. So it's no longer going to be as firm because you've lost the elasticity. And in addition to that, it's going to start to sag and become also irregular, not just due to the top epidermal layer, but also due to what's happening at the next layer. So I'd shown you before just a depiction of the epidermis, which I mentioned is this white layer that is incredibly thin. And this pink layer that I have underneath is basically giving you an idea of how thick our dermis is. So again, this pink layer is where we contain our elastic fibers and our collagen fibers, most notably. And this is the layer that's important for, very much so, for the structural integrity of our skin. So what starts to happen when our dermis starts to get damaged? What are the damages that the sun is doing? So as we mentioned, the ultraviolet rays do get to the pink layer. When they start getting to the pink layer, or the dermis, now what happens is the skin cells that are responsible for producing collagen and producing elastic fibers start to actually break down these fibers. So now these fibers start to break down. In addition to that, the elastic fibers start to break down. So a lot of structural things start to happen. Well, one of the earliest things that I can give you an example of, if you look in this picture here, a relatively young person, is the tiny wrinkle that she's starting to form on the outer corner of the mouth. Of course, this is a smile line, but we can accelerate how quickly these smile lines occur by sun exposure. So this is an accelerated process of aging. Everyone's going to get basically smile lines at some point as you age, but this will make them come sooner when you're getting sun exposure and you're breaking down collagen and elastic fibers sooner. So this is a great example of just the earliest types of changes we start to see. And then in this other image, of course, I'm showing you the typical crow's feet that we see, and these lines again are from squinting. And again, of course, over time, almost anyone can get crow's feet regardless of sun damage. But if we damage our collagen layer, that pink layer I just showed you, if we damage the elastic fibers and the collagen fibers, we are going to accelerate the appearance of these lines, and we're going to obviously accelerate their development over time. So again, we can do things to help stop this. Lastly, I'm showing you also another picture of early collagen damage, shown here with this patient with her forehead, which again, just another great example of how early collagen damage starts to show up these expression lines quicker. And by the way, in the case of this forehead, you can also see some irregularity of the pigmentation, which is another factor that we talked about earlier as far as the epidermis. So, of course, things are happening all at the same time. So I don't mean to say that we age at the epidermis or top outermost layer exclusively and then nothing's happening in the dermis and then the dermis starts to age. Things start to happen all together. It's just that typically the epidermis is where we first start to see these changes, but quickly thereafter we start to see it in the dermal layer. So we mentioned the dermis, we mentioned how the firmness of the skin is affected. So in this other image, I'm showing you just a typical example of early aging where you start to see a little bit of, let's call it looseness or laxity of the facial skin. And you can see it here in this image where there's just a little bit of like irregularity and softness and a little tiny bit of sagging to the skin in this area. This is another very common thing that patients will comment on in the early aging process. And again, this starts with damage to our collagen and elastic fiber layers in our skin, which is in the dermis, which I mentioned to you before as I showed you was that pink layer that we see that's certainly thicker than the epidermis. So now you have a little bit of a better picture. We start to see, of course, fine lines and wrinkles due to the collagen damage. And you start to see sagging or very mild laxity, which we see due to the damage to the elastic fibers and also due to the damage of the collagen. So as we continue to age, we now get to the final third and deepest layer, which is the subcutaneous layer. So I don't have a model of the subcutaneous layer, but I can tell you just simply with my fingers that the subcutaneous layer is typically about this thick. So now we've reached the thickest part of our overall facial skin or neck skin, whatever we're talking about. And of course on the neck, all these things are much, much thinner. But just generally speaking, the subcutaneous layer, which is the deepest layer, is the thickest layer. And this layer is typically composed of fat and connective tissue or collagen. So as we continue to age, this layer is also affected. This layer is affected by gradual sagging as well. So one of the most common places that we see this type of effect that is really just annoying to a lot of my patients has to do with the neck angle. So at this point in the neck, you start to see where a little bit of sagging patients notice, especially in photos and just in a profile picture. They start to see this sagging of that submental, we call this a submental or the neck angle. So that's one area where, in this case, the subcutaneous layer with some bit of the dermal layer, but primarily the subcutaneous layer, is starting to sag. Of course, when the subcutaneous layer sags, we also find typically that we lose a lot of fat at the same time. So a deflation or a sinking of the face in general, or sort of a loss of padding of the face and a volume deficiency of the face is what we see in more advanced aging. Now we're getting, typically into multiple decades of aging. And in that case, we start to see folds develop. We start to see jowls, which is the sort of the sagging along the jawline. We get loss of definition of the jaw because, of course, things are sagging. And then we get accentuation, in many cases, of the hollows under the eyes because the cheeks, for example, are starting to fall or descend because aging is happening at all three layers, the epidermal, dermal, and subcu. And so as this happens, we start to get where changes to the eyes start to occur concurrently. So in that case, we start to see bags that are under the eyes that we all have. We call these fat pads that exist around our eyes. You're starting to lose the padding around those pads, so they start to become more noticeable at the same time that things start to sink and deflate. And so in the case of this patient here that I'm showing you an image, this is a typical example of where we see some type of aging throughout the entire face, where we have the eyes affected, the eye bags affected, the cheeks affected, the folds affected. A lot of things are happening in this case, and this is just typical of aging as we extend further and further. So these, I hope, are good examples for you to help you understand how it is we age, what things are happening, and what is happening to us as we see ourselves aging. I should mention, I didn't touch on hair, of course, and hair is huge. Obviously, as we age, we see a lot of changes to hair in both, obviously, men, but also women. And we start to see that the texture and the girth of the hair shafts, the hair caliber and quality, the hair density starts to reduce. So you don't have that typical youthful, full head of hair that we see both in men and women. In men, obviously, the hair changes are more specific pattern related, where the recession of the frontal hairline starts to occur. So the hairline is starting to go backwards, and in addition to hair loss at the top, usually at the back, we call that the vertex. And in women, we typically see just a thinning of the top of the head. We call that the crown. So there's just a general thinning and reduced quality of hair. And we'll get to hair at a different episode. We're not going to cover that now. But I would be remiss if I don't even touch on hair, because that's happening at the same time. And of course, these hair changes have nothing to do with sun exposure per se. These are just other age-related changes, just like what we see in the subcutaneous layer, where really the sunlight hasn't penetrated or reached that layer, but nonetheless, we are seeing some aging changes related to that. So I hope you've enjoyed this episode, and we've covered a lot of different topics have to do with aging. And then these topics will come back as we discuss what it is we do to fix these things and what it is we can do to prevent these things and try to delay the process of aging. Feel free to follow us on Instagram and TikTok at Dr. Oscar Hevia. That's Dr. Oscar Hevia. Thank you for watching and listening to Keep Looking Young.